Hello, this is the second lecture in the group of lectures discussing the physical principles of ultrasound, and in this lecture we will be discussing reflection, scattering and refraction. In the first lecture we were talking about the nature of ultrasound and how that ultrasound wave propagated through the tissues, and in this lecture we'll be talking a little bit further about the movement of ultrasound in tissues in relation to how the ultrasound wave interacts when it comes across two tissues that are of a different type. In order to discuss reflection, we've got to understand the concept of acoustic impedance. And this is important because having a difference in acoustic impedance is what determines reflection of ultrasound waves. Now, histologically, tissue can look very different, whereas on echo they look a bit similar. And that's because tissues do have very different densities and propagation velocity, as we discussed in the previous lecture. Acoustic impedance is determined by both the density and propagation speed. And from this, we can get an idea of what the acoustic impedance difference is between two tissues. And this is, we often describe this as Z1 or Z2 for the difference in acoustic impedance. When a sound wave is emitted, it's described as the incident ultrasound wave. When we then get an interface between two tissues, some of that sound wave will continue through into the second tissue, and this is known as the transmitted wave. And some of that is also reflected. And so the reflected wave comes back towards the transducer, and that's what we pick up in terms of echoes, for example. The amount of the reflected intensity divided by the incident intensity is known as the intensity reflection coefficient. In terms of the amount of energy or the intensity of the sound wave that's transmitted through into the second structure, that is, if you took the transmitted intensity and divided that by the incident intensity, that will be known as the intensity transmission coefficient. And what we must understand is that the intensity reflection coefficient plus the intensity transmission coefficient must add up to 1. And a way to try and determine what that interface reflection coefficient is, if we divide the intensity reflection coefficient divided by the intensity reflection coefficient, we can say Z1 or Z2 minus Z1 divided by Z2 plus 1, square that. We can get our interface reflection coefficient. Now I'm going to ask you to consider three situations here. First, consider that there's no difference in the acoustic impedance between two structures. Now that means that we're going to get 100% transmission, and then the intensity, the interface transmission coefficient will be 1. And that means that the intensity reflection coefficient will be 0. Now let's consider two structures that have a somewhat different impedance, such as, say, liver versus fat. That means that we're going to get a portion, a small fraction of the incident intensity, and it's going to be reflected back, but the remainder is going to be transmitted. Now let's consider a third scenario where we've got a huge difference in impedance, such as between soft tissue and air, for example. And that's where we're going to get a total reflection coming through, so that the reflected energy is going to be almost 100% compared to the transmitted intensity, which will be very small. I guess all I'm trying to use the example is that if you've got a transducer probe positioned on the skin and you've got some sound and you've got some air there, you're going to get a huge difference in acoustic impedance. And that means that the vast majority of the sound wave will be reflected back before it even gets into the tissue. This is the importance of using ultrasound gel, so that you get a kind of, a medium, so that you don't get such great differences in acoustic impedance between the transducer probe and the skin. So in terms of this, in terms of the reflected pulse versus the incident pulse, if we had an example of, say, 0.1 for the intensity reflection coefficient, that means 10% of the incident pulse will be transmitted. And also, when you then get a reflection from a lower structure and that comes back.
Sorry.
No problem.
Just start that slide again.
No problem.
Sorry, not a cough.
If we consider the amount of the instant pulse that's reflected back, if we talk about the intensity reflection coefficient of being 0.1, that means that 10% of the instant pulse will be transmitted. It's important to remember that then also if you get an echo that's returned from lower down that then comes across this interface again, we're going to get a further 10% of energy will be lost on reflection. In terms of how the sound wave interacts when it comes across this interface between two tissue types, it's important to think about the actual smoothness of the interface. If you have a completely straight, clean interface, you're going to get a large amount of reflection, which is known as specular reflection. If you have a bumpy or a rough surface, you're going to get some form of scattering that occurs. And this is where we get the idea of specular reflections, such as you can see from the example here, of sort of a mirror image that happens off a lake, for example, versus looking at a mirror that's all misted up with water particles all over it if you're in a steamy bathroom. That gives you an example of what the difference between specular reflection is and scattering that should occur. In terms of how this relates to ultrasound, you get scattering that occurs when the interface is less than 1 wavelength or you're imaging a rough surface. And I think it's important to say that the majority of echo information that we see in an ultrasound image comes from scattering rather than from reflection between different tissues, because you're coming across the difference in muscle fibers or the difference in blood. You know, small blood vessels are going to reflect the ultrasound wave. So the majority of echoes that we see are scattered sound waves. When the ultrasound wave hits one of these red blood cells or rough surface, you're going to get reflection happening in many different directions. And it's not going to be uniform scattering, and that scatter is going to be dependent on frequency, because the interface has obviously got to be less than 1 wavelength. It's going to be angle independent. You're not going to be able to determine which directions those angles are going to be coming off at. And it's important to remember that the scattered energy is going to be lower than the reflected energy, both from loss of energy from the sound waves scattering in many different directions, as well as from something such as attenuation, where you get some loss of the sound wave from friction. As the sound wave hits a small structure and you get multiple different directions of the sound wave being moved off at, you're going to be getting those sound waves that are going to be moving in multiple different directions, and it's going to be coming off from multiple different reflectors. In this way, you can get sound waves that join together that can either be constructive or destructive, as can be seen in the bottom left-hand image here. If you get, for example, structures that are maybe, say, a quarter of a wavelength apart, and they are then going to be destructive against each other, you're going to have a much less echogenic structure than something that's maybe a half of a wavelength apart. And that means where you're going to get some constructive interference. I guess what I'm trying to say, that you're going to get this kind of noise that's going to be produced in ultrasound images, and that's going to be happening because of the interference from multiple small reflectors that are happening, particularly seen in things like muscle, where you're going to get lots of different you're going to get lots of different boundaries where ultrasound waves are going to be reflected off. This is important because it's used in some, particularly sort of more advanced imaging, like speckle tracking, for example, where we get these kind of characteristic speckles and we track them to see how it's moved and how they move together. Example in echo, as they move together in systole and they move apart in diastole. And this is one of the ways that we try and measure systolic and diastolic function in more advanced measures, is actually using these speckles that are formed because of the interference and the sum of waves that are either constructive or destructive. So as well as refraction, we're also going to be seeing something called refraction, and this is this. If you look at a straw and a glass, you're going to be seeing that change in the difference in the angle of the straw. Or if you look into a pool, it generally looks shallower than it really is. And this because the light is refracted. And the same thing happens in ultrasound, where it's all dependent on the propagation speed in the media. So that if you're going to get, for example, a less dense medium as opposed to a denser medium, you will get refraction of that wave. So before we've considered the wave which comes directly on at 90 degrees to a interface, and that's what's known as a normal angle, known as normal angle of reflection. If we have an incident ray, that means it comes off at an angle, which is known as a theta, and the greater the theta is, the smaller or greater, depending on the propagation speed in the second medium, the smaller or greater the transmitted ray, or the theta t. This is dependent on Snell's law. And Snell's law says that the propagation speed in 1 divided by propagation speed in 2 is equal to the sine of the incident angle divided by the sine of the transmitted angle. So if we consider the different scenarios, the first is where the propagation speed in the second media is greater than in the first media, we will see that the transmitted angle is going to be greater than the incident angle. If we have the propagation speed that is exactly the same in the second media compared to the first media, we are going to get the incident angle being the same as the transmitted angle. And finally, if we're in a stage where the propagation speed in the second media is less than in the first media, that means the transmission angle is going to be less than the incident angle. Okay? So it's all going to be determined by the difference in the acoustic impedance between the two structures and the difference in the propagation speed, which is dependent on density of the structures, obviously. We have to have an oblique angle as we come in. Otherwise, if you're at simply a normal angle, the transmission is obviously going to be straight ahead. And that means that obviously with a normal instance, you're not going to have any refraction. If the propagation speed is higher in the second tissue than the first tissue, as we've just said, we know that the transmission angle is going to be greater than the incident angle, as we just discussed. What's also going to happen if the propagation speed is greater in the second tissue compared to the first tissue is that we're going to get something called a critical angle that's going to exist. And this critical angle is going to be that angle where the ultrasound refracted is going to be, at the transmission angle, is going to be 90 degrees, as you can see in the example B here. If your transmission angle then is any greater than that transmission, is going to be greater than that critical angle, we are going to get no energy transmitted at all. And 100% of the energy will be reflected. So just to say that again, if we've got a propagation speed that's higher in the second tissue compared to the first, we know that the transmitted angle is going to be greater than the incident angle. There is going to be a time, or there's going to be an angle where that transmission angle is going to be 90 degrees. If the incident angle is greater than that critical angle, then you're going to get 100% reflection and no transmission at all. To try and determine exactly what that critical angle is, we're going to use Snell's law again. And we're going to change it around a bit so that we say that the sine of the incident angle divided by the propagation speed in that first medium is going to be equal to the sine of the transmitted angle divided by the propagation speed in that second medium. Then, as we said, that critical angle is going to exist when the transmission angle is 90 degrees. Sine 90 is 1. So we can then say that the sine of the incident angle divided by the propagation speed in that first medium is going to be equal to 1 over the propagation speed in the second medium. And that, rearranging that, will show you that the sine instant angle, or the critical angle, is going to be equal to the propagation speed in the first medium divided by the propagation speed in the second medium. So in summary, structures in the body are going to have an acoustic impedance determined by their density and propagation speed. Having a difference in the structure's acoustic impedance is what's going to determine the amount of ultrasound energy that will be reflected back. The amount of energy that is reflected back added to the amount of energy that is reflected forward must equal 1, or must equal 100%. So 100% of the instant angle, some of it will be reflected and some of it will be transmitted. Whether a structure is, whether an ultrasound is reflected or scattered is determined by the surface of the media, as well as the size of the media. If it is less than 1 wavelength in size, it's going to be scattered rather than reflected. We'll try and remember that scattered ultrasound waves make up most of the image. Refraction is going to occur if there is a difference in the propagation velocity between the two structures and there is an oblique angle that the ultrasound wave is hitting the surface. And refraction is going to occur when this instant angle is away from the normal. And finally, if we remember that the propagation speed is higher in the second tissue than the first tissue, then a critical angle is going to exist. And this critical angle is when the transmission angle is 90 degrees. And if we go above this critical angle, then 100% of the energy is going to be reflected and there's going to be no transmission at all. And that's it for reflection, scattering and refraction. I hope this was useful. Thank you very much.